As of August 5, 2025, Central Harlem finds itself at the center of a growing public health concern that has captured the attention of both local residents and city officials alike. The vibrant streets and historic neighborhoods of Harlem, known for their rich culture and resilience, are now facing an unexpected challenge that has brought a sense of urgency to the community. The area is currently experiencing an outbreak of Legionnaire's disease, a serious type of pneumonia caused by Legionella bacteria, which can be especially dangerous for older adults and those with weakened immune systems. Hospitals and clinics in the neighborhood have seen a noticeable increase in patients presenting with symptoms such as cough, fever, and shortness of breath. The New York City Health Department has launched a comprehensive investigation into the outbreak, working around the clock to trace its origins and contain its spread. Since July 25th, there have been 58 confirmed cases, a number that has raised significant concern among public health experts and the community at large. Tragically, 2 lives have already been lost to this outbreak, a sobering reminder of the disease's severity and the importance of swift action. The community has come together in moments of mourning, holding vigils and supporting affected families, while also demanding answers and solutions. The majority of cases have been concentrated in specific Harlem zip codes, prompting targeted outreach and monitoring in these neighborhoods. However, health officials are also keeping a close watch on surrounding areas to ensure the outbreak does not spread further. Teams of health inspectors are actively investigating potential sources, such as building cooling towers and water systems, which are known to harbor the bacteria if not properly maintained. Their efforts are focused on identifying the source quickly to prevent additional cases and protect public health. The NYC Health Department has issued alerts throughout Harlem, urging residents and visitors to stay informed, recognize symptoms early, and seek medical attention if needed. Community centers and apartment buildings are displaying information to raise awareness and encourage vigilance. Understanding Legionnaire's disease, how it spreads, what symptoms to look for, and the steps being taken to address the outbreak is now more important than ever. Education and awareness are key tools in the fight to stop the disease and keep Harlem safe. In the following sections, we'll take a closer look at the origins of Legionnaire's disease, the response from health officials, and what you can do to protect yourself and your loved ones. Together, we can work toward restoring a sense of security and well-being for all New Yorkers. Legionnaire's disease is a severe and sometimes life-threatening lung infection caused by a type of bacteria known as Legionella. These bacteria are not commonly found in nature, but they can become a serious problem when they multiply in certain environments created by humans. Legionella bacteria thrive in warm, stagnant water, making man-made water systems like air conditioning units, hot tubs, decorative fountains, and even large plumbing systems ideal breeding grounds. When these systems are not properly maintained, the bacteria can multiply rapidly, increasing the risk of infection. The real danger arises when contaminated water becomes aerosolized, turned into tiny droplets or mist that can be inhaled. Everyday activities such as taking a shower, using a hot tub, or simply walking past a decorative fountain can expose people to these invisible droplets. Importantly, Legionnaire's disease is not spread from person to person. Instead, it is contracted through environmental exposure, meaning you can only get sick by breathing in contaminated water droplets, not by being near someone who is already ill. Early diagnosis is crucial. When caught in time, Legionnaire's disease can be effectively treated with antibiotics, which target the bacteria and help the body recover. Doctors may also provide supportive care, such as oxygen or fluids, depending on the severity of the infection. Most healthy individuals who receive prompt treatment recover fully and return to their normal lives. However, certain groups, such as older adults, smokers, and people with weakened immune systems, are at higher risk for severe illness. For these vulnerable individuals, the disease can progress quickly and, in some cases, become fatal if not treated promptly. Complications like respiratory failure or septic shock can occur, especially in those with underlying health conditions. The mortality rate for Legionnaire's disease is about 10%, but this number can be higher in hospital outbreaks or among people with compromised health. This statistic highlights the importance of rapid medical attention and public awareness. Understanding that Legionnaire's disease is linked to environmental sources helps guide public health efforts. Investigators work to identify the origin of outbreaks, often tracing them back to contaminated water systems in buildings or public spaces. Health officials and building managers collaborate to clean and disinfect contaminated systems, such as cooling towers and plumbing, to stop the spread of bacteria and prevent new cases from emerging. Raising public awareness, encouraging regular maintenance of water systems, and seeking early treatment are all essential steps in managing and ultimately preventing Legionnaire's disease outbreaks in our communities. Legionnaire's disease spreads through inhaling aerosolized Legionella bacteria. Contaminated water droplets from cooling towers and other systems are the main culprits. Large-scale air conditioning systems can disperse bacteria over wide areas. Drinking water is not a risk. The danger lies in inhaling contaminated mist. Home air conditioning units are generally safe, unlike industrial systems. Public health investigators are testing water samples to find the outbreak's source. Identifying and decontaminating the source is crucial to stopping the spread. This focused approach helps protect the community from further exposure. Recognizing the symptoms of Legionnaire's disease is absolutely vital for protecting yourself and those around you, especially during an outbreak. Legionnaires can be difficult to distinguish from other respiratory illnesses at first, so knowing what to look for is crucial. The earliest signs often mimic the flu or a bad cold. Fever, chills, headache, and muscle aches are common. You might feel suddenly tired or notice your body aching more than usual. These symptoms can appear mild at first, making it easy to overlook them or mistake them for something less serious. As the infection progresses, symptoms can become much more severe. A persistent, worsening cough is typical, and it may be dry or produce phlegm. Shortness of breath, chest pain, and difficulty breathing are warning signs that the illness is affecting your lungs more seriously. In some cases, people may even require oxygen or hospitalization. Legionnaires doesn't just affect the lungs. Some people experience confusion, trouble concentrating, or even disorientation. Nausea, vomiting, stomach pain, and diarrhea are also possible, making it easy to confuse with other illnesses. If you or someone you know develops these symptoms, especially after being in an affected area, it's important to take them seriously. The incubation period, the time between exposure and the first symptoms, can range from 2 to 14 days. This wide window makes it challenging to pinpoint exactly when or where you might have been exposed, especially in busy urban environments where people come and go frequently. Because of this, health advisories are broad, covering anyone who has spent time in affected neighborhoods since late July. Even if you only visited briefly, you could still be at risk, so it's important to stay informed and alert to any new symptoms. Don't ignore or dismiss symptoms, even if they seem mild at first. Early diagnosis is the key to a full recovery. If you're unsure, it's always better to check with a healthcare provider than to wait and see if things get worse. Medical professionals use specific tests to confirm Legionnaire's disease, such as a urine antigen test or a chest X-ray to look for pneumonia. These tests help doctors quickly identify the infection and start the right treatment. If you develop symptoms, especially if you live in or have visited the affected areas, seek medical attention right away. Prompt care can make a significant difference in your recovery and help prevent complications. Be sure to inform your healthcare provider about any recent visits to Central Harlem or other outbreak locations. This information helps them make a faster, more accurate diagnosis and ensures you get the right care. Early treatment with antibiotics can reduce the risk of serious complications and greatly improve your chances of a full recovery. Most people recover completely with timely medical care. Remember, your health is the top priority. The healthcare system is prepared and ready to help you through every step, from diagnosis to recovery. Stay alert, act quickly, and take care of yourself and your community. Certain groups are more vulnerable to Legionnaire's disease. Adults over 50, smokers, and those with chronic lung conditions are at higher risk. Compromised immune systems, due to conditions like cancer or HIV, increase susceptibility. Healthy individuals may experience mild symptoms or none at all. During outbreaks, awareness of symptoms is crucial for high-risk groups. Monitor health closely if you're in a vulnerable category and have been in affected areas. Early medical care can be life-saving for those at higher risk. Community awareness helps protect our most vulnerable members. The NYC Health Department's response is swift and comprehensive. Epidemiologists are tracing patient movements to identify common exposures. Environmental testing focuses on cooling towers, common Legionella sources. Remediation of contaminated towers is underway to eliminate the threat. Public communication is key, with health advisories issued through various channels. Dr. Tony Isolen emphasizes the treatability of the disease and vigilance. Timely updates empower New Yorkers to protect themselves. The department's efforts aim to control the outbreak and safeguard public health. Trust in the process and stay informed through official channels. Building owners play a crucial role in preventing Legionnaire's disease. NYC regulations mandate regular inspection and maintenance of cooling towers. During outbreaks, owners must provide access for health department inspections. Positive Legionella tests require immediate cleaning and disinfection. Follow-up testing ensures successful remediation and long-term safety. Compliance is monitored with penalties for non-adherence. Residents should inquire about their building's maintenance plans. Responsible building management protects tenants and the community. Cooperation between officials and owners is key to preventing future outbreaks. Diligent maintenance safeguards public health. If you're in affected areas and develop symptoms, seek medical attention. Early intervention is crucial for effective treatment. Communicate symptoms and recent visits to Central Harlem to healthcare providers. Legionnaire's is treatable with antibiotics when caught early. Quick action prevents complications and aids recovery. No need to isolate. The disease isn't spread person to person. Focus on getting the care you need. Trust medical professionals, they're prepared to help. Severe symptoms warrant an emergency room visit. Your health is the priority. Act promptly. Community strength is vital during the Harlem outbreak. Stay informed through reliable sources and trust public health experts. Avoid panic and misinformation. Rely on official updates. Check on vulnerable neighbors and remind them to seek care if needed. Community solidarity and vigilance are powerful public health tools. Trust the health department's methodical investigation and remediation efforts. Swift action on contaminated towers shows the system is working. Recovery is common with prompt treatment. Healthcare providers are ready. Follow public health advice and support one another. Together, Harlem will navigate this challenge successfully.